Thank you all so much for joining today. We're the Community Health Equity and Engagement in Research Initiative, and we're presenting Sharing Study Results with Community and Ethical Imperative. So we're going to have lots of wonderful group discussion, and we appreciate you coming. First, we'll go over some housekeeping items. We're so glad you're here. I'm joined by my wonderful colleagues, Paula Moody and Jess Abram-Shortle. So just some session logistics. This presentation is being recorded. Please do raise your hand to ask questions. We want to make this as interactive as possible, and we certainly want to be able to provide feedback to those questions you might have. Also, feel free to use the chat feature to make comments, share resources, and make connections. And please know that presentation materials will be shared post-session. To kick us off, we're going to go over some background on this topic. Then we're going to do an interactive breakout discussion. We'll come back then and do a group debrief. And then we're going to talk about some of the work that we've done in this area of lay dissemination. We'll wrap up with questions and answers and resources. So for today's learning goals and objectives, we're really trying to engage in an ethical dive into the challenges and facilitators of lay dissemination. And then we're hoping to share with you some of the community-driven focus group data that we've done on approaches to translating study results to broader communities. So we're going to kick off with this quote: "Reporting research findings to participants is an ethical imperative. Dissemination must become the default expectation for all of research." So just by sharing some thoughts, what strikes you about that quote? We've seen over the last decade, really this drive for returning results back to study participants. And in this way, we're talking about aggregate study results. The return of individual results is a whole nother area of ethical exploration. But when we're thinking of returning study results back to participants, what does this mean to you? Yeah, so one for I love the default expectation. It should be the norm. I agree with you, Liza. So this is becoming something that funders are now expecting. This imperative for all of us as being good stewards of research, and being able to share those two results back with participants who, without them, the research really wouldn't be possible. And then also to the broader community so that they can learn from those research findings and it can improve their health in some way. But as we're going to be discussing, there are a lot of challenges inherent in this process of lay dissemination. So let's back up and just look at some of the overarching ways in which we can reach study participants in the broader community with results dissemination. So a lot of us in the room are probably very familiar with the scientific audiences that we strive to reach when we're sharing study results. This is through publishing in academic journals. We may be attending conferences, sharing presentations at those conferences of the work that we're doing, or maybe asked to give professional lectures. So that's some of the ways in which we engage with the scientific community to share our results. Any of us that have participated in authorship know that sometimes that stage to actually take our results and get it published in a manuscript can be a lengthy process. It requires a lot of work and effort to see a paper to fruition and get it accepted into a scientific journal. But then there's this whole other area of broader community dissemination. And this can be done in a number of ways. And we're going to, when we talk about our focus groups that we've completed this past fall into the winter, we'll share some of these methods that we employed as potential ways that we could share lay dissemination with community. So some examples would be a lay brief, which is really taking a research publication and translating it to an audience in a more consumable way. So instead of reading through the scientific jargon that's often commonly prevalent in our research publications, really translating into very lay language, offering more images and graphics to represent that important research finding information. Another example is a data walk. This was really pioneered through the Urban Institute And the idea is that we essentially share information, these results, in a meaningful way within a community setting. So getting out into the community to be able to have those results be part of a larger discussion, and that can lead to a call to action and next steps for that work. There's also newsletters that can be employed, media, right? Social networking, other platforms to get study results out, and then front porch grand rounds. So these are just examples for the front porch grand rounds, thinking of maybe the research team meeting directly with the community in an informal setting, or it could be a video that they create that is then disseminated to share the results in a meaningful way back to those study participants in the broader community. So again, it's not a one-size-fits-all approach, but those are just a smattering of some of the examples and of the ways in which that we could potentially offer those results in a meaningful way to our study participants. The issue is that it's been understudied, and there's really not a lot of resources in place to really guide the development of those lay dissemination methodologies. But if that infrastructure was in place, it really can lead to some wonderful benefits. First and foremost, it can enhance health literacy among our study participants and the broader community. So if we want them to be more empowered in the healthcare setting, we can start in the areas in which they engage in research by making sure that they are receiving information that is meaningful to them, that makes sense to them, and that positions them to be able to make effective decisions. It also can increase trustworthiness in the research process, which is something that we are trying to do overall as an institution to enhance the representation of our communities in research. And so if we're giving back the value that they provided to the research study by demonstrating what those results were and translating it for them in a way that's relevant and makes sense to them, they're going to be more likely to want to participate in research again. And this is information that we have found from our focus groups that we will share a little bit in more detail with soon. It also can help to improve translation and practice and policy. And so by translating our study results, many times the end user is the patient population, the study participants, and the broader lay community. But it also could be clinicians and health system leaders and folks in policy who can really drive those research findings into meaningful change. And then finally, ultimately, what we're trying to do is reduce health disparities and improve health equity. So we see this as sort of the underpinning to why we should be engaging in effective lay dissemination. And this graphic over to your right really demonstrates to researchers and to most of you on the call, the importance of carving out the time and energy around this area of dissemination. While we focus so much on scholarship, we really want to have equal efforts towards this lay process in order to continue to improve our understanding of research findings among our communities, build that trust, and then strengthen those community academic partnerships, which we like to encourage because that's what we do in SENR. We try to have academia partner with community, and we really see the value in that being a very effective vessel for lay results dissemination, which ultimately then we hypothesize will increase research study recruitment and participation. The Declaration of Helsinki states all medical research subjects should be given the option of being informed about the general outcome and results of the study. So we have these governing bodies and these regulations in place to support the protection of human subjects. And one of the criteria is that our participants should be informed of the general outcome and what those study results were. But we know that in doing our thorough scan of the literature, this is really not done efficiently, not done effectively. There's lots of holes in the ways in which we communicate with our study participants, not only throughout the study, but most importantly at the end of the research. And then it comes into this ethical dilemma of what's required versus what's simply good practice. So dissemination is a shared responsibility between funders and researchers, and we see some of our funders now really having this mandate, specifically PCORI, who's been really a pioneer in this idea of elevating stakeholder voices and particularly patient voices to research. they require researchers to share study results with study participants. And while they do provide some guidance on what that can look like, we're still missing some of the tools, templates, and resources that I think we need as an institution to really make sure we're thriving in this space of lay dissemination. There's also variation in expectations in practice. So what works for one study might not work for another study. You might not have the same funding, the same capacity. The participants and the broader community for a particular study might have unique ways in which you need to communicate with them. So having that background and knowing how to gather that data up front so you can have a really effective lay dissemination plan is of utmost importance. And we know anecdotally from speaking with researchers that there are just lacking in clear pathways and training to really support their roles as effective lay disseminators of their research results. Then we have this whole idea of open access. Sure, many of you have heard of this if you've recently published or really in the past at least decade. When we think of this idea of publishing in journals that have this open access option. And so it used to be that open access journals, you would have to pay a little bit more to have gold open access or green open access. And this would allow your research article to be deposited in a way that the public could view, which is great, right? It checks a box in terms of making it more available. But sometimes you needed a lot of funds to come up with, oftentimes $3,000 to $4,000 to make your article open access. NIH came along and they decided to institute NIH public access, which does the same thing for free, which is great if you have work that's funded through NIH. It allows your work to be deposited in an open repository so that it's available to the public. And now our Penn State Libraries also has an open access policy, which mandates that we make efforts to make our work freely available. And so they have a lot of partnerships with various journals and publishing companies to allow for that process to deposit our work and make sure that it's available to the public. The issue, though, as many of you are probably aware, is that the journals that we write, the papers that we write for those journals, are not always written in a way that the public can digest and make meaningful information from, pull meaningful information from. So we're left to provide this option. We're left to deposit these manuscripts, but is that really doing enough? And what we're finding is that it's not, because our patients and broader community are not going to those journals and reading those articles. What is exciting us a little bit is that we're seeing that these journals are also requesting to have some type of lay summary as sort of an addendum to the paper. And that's being made available on the journal's website. So that's exciting. It's a way to give a little piece of information of what that paper is about. But again, for a lay person to know to go to that journal website and find that information can be a lot of work for us to get that information out to them. So I want to take some time now to split you up into groups, and I want us to consider really this ethical dive into these implications of not sharing aggregate research results. So in being good stewards of research, where are you in your process of dissemination? Have you tried to share study results? What did that look like? If you haven't, what are some of the implications of not sharing that information back to your study participants? Then I'd like you and your group to please think about this idea of individual return of research results. It feels like we're miles away from that, but at the same time as we think of genomic data and other data collection that an individual might be able to make some more informed healthcare decisions if they receive some of that information that was collected for research purposes, what are some of those ethical decisions and scenarios that need to be played out when we think about this individual return of results? And then finally, what barriers do you anticipate facing in sharing your study results? We have a Google Doc into the chat, and we are going to break you up into small groups. We're going to give you a decent chunk of time to work in your group, and you can just add to the Google form your responses, and then we'll do a group debrief. And I'll send a message out to all groups letting you know how much time you have. Okay, I think we have everyone back. So we're just going to have a group debrief. So please feel free to unmute yourself and share if you are comfortable doing so. We'll start with the first question. What are the implications of not sharing aggregate research results?
As I'm looking through the form that we use, which I think was very helpful, thank you. I mean, certainly trust and distrust were a major theme there.
Yeah, so let me ask this. Do you think when participants sign up for research studies, do you think there's an expectation that they would receive results?
Most of the time, if I can say, sorry, I was late and just came to the discussion. I think many times we as investigators, we let them believe that what they're doing is it may not help them, but this research may be helpful for the future patients. And then many times patient either say it, or it becomes an expectation that we will share the results with them, even though it may not help them for that matter. So there's either said or unsaid expectations from investigators to the patient, and we can always ask them, would you like to be shared with you, or now results are available, rather than imposing them that no, you got to hear about it. That may help with the discussion.
Thank you, Rahul. Very helpful.
Another thing that we discussed was that sometimes with the results of our studies, we find things that might be a bit disparaging for communities. So it can be kind of hard to try to disseminate that back without having the answers to go along with it, especially when we're just kind of like highlighting like these are problems that we see, but we don't have anything, you know, to go along with it. So that can be hard to hand back to the community without answers.
Great point. What about some ethical considerations for this idea of individual return of research results?
The right to know, the right not to know. So two different views, and that's the individual right to know, as well as the right not to know if they so choose.
Excellent, thank you.
This is Lori. Our group talked about potential issues when you're sharing like clinical results that, you know, they're not diagnostic, but people may take that as a diagnosis. You know, just concerns about that, especially, not, I shouldn't say especially, for me personally, you know, I get this a lot with parents because I work with kids. Yeah, we always say, please see your provider or, you know, another professional, because these are not diagnoses or diagnostic information.
Absolutely. Yeah, and I think that bleeds into this idea of, you know, are study results showing causation or just correlation, right? And how do we make sure that messaging is communicated very carefully and intentionally so that we aren't adding to misinformation? What barriers do you anticipate facing when you think of your own research and in trying to share your study results? And we'll do it through the lens of aggregate results. And please consider aggregate results in all types of research. So specifically clinical trials, yes, but we have behavioral interventions, we have observational studies. Those are all important. They generate important findings. So no matter what part of the research spectrum you fall on, What do you think would be some challenges to sharing your results broadly?
One thing that came up in our group was the difficulty of maintaining contact with participants in order to be able to send results to them or whatever. It can be very challenging, especially when you're doing longitudinal studies, even for study retention, to keep people to keep in touch with people. And then once there can be a long time lag before that you are able to provide aggregate results, and by that time you may have really lost track of people. And I think someone from another group, they even pointed out that your IRB may require that you destroyed identifying evidence or identifying information, so you have then no way to get in touch with people, unless, I mean, there's probably creative ways to manage that, but it's a potential barrier.
Yeah, I think that's excellent, Carol. And you know, a word that sticks out for me that you mentioned was retention. And I feel like when we think of retention and then we think of dissemination, they're very separate things, but perhaps the model moving forward in this paradigm shift is seeing dissemination as an extension of the retention activities that we would do throughout the research process. So such that we're engaging the research participants throughout the entire study, so that when it comes to dissemination, we still have that open bidirectional communication to allow for that dissemination to be shared. And I think this really gets at the heart of keeping participants engaged throughout the entire study. And this was an aspect of our focus groups that we'll be talking about just next, that we had found from participants sharing that there really wasn't much engagement. They signed up for the study. It, you know, could have been up to a year or 2 years, and they would go to their study visits and they would have no idea what was going on outside of those visits. So when it came time for lay dissemination, some of them weren't actually that surprised that they didn't hear anything, because they weren't really hearing anything all along. So it might be, the impetus might be placed on having better retention strategies that can then lead more successfully into a lay dissemination model that works. Any other barriers? Do you all feel like you're well equipped to, let's say you had time and you had participants' contact information and your IRB wasn't an issue, the study was open, and so you were able to reach back out. Do you feel well equipped to engage in lay dissemination? We can do a show of hands. And if you don't feel equipped, that's okay. That's why cheers in business. Excellent. Okay. Well, we're going to segue now and share a little bit about a focus group pilot that we completed this past fall. We're still in the analysis phase, but I'm going to pass over to Paula, and she's going to share some of the insightful work that we've done, and we'll go on to next steps from there.
And can you advance the slides for me? Good afternoon, everyone. My name is Paula Moody. I am a research project manager in partnership with my colleague Jess Schrodel, who is also on the call today, for the CEnR initiative. And I'm going to speak a little bit with you today about a qualitative pilot study that we did in the fall. The purpose of our study was to gain qualitative information from the community about their thoughts regarding lay dissemination. We built some of this off of the truest kind of meaning behind community engaged research. And by that, I mean, we wanted to go to the community and hear from them directly what their thoughts are about lay dissemination. So we designed this pilot study to gather qualitative information, so we could take that back to some of the research
investigators that we work with here on the Penn State Hershey campus and across the Commonwealth, so we could share with them what the community is saying are the best ways that they want to receive information. So we conducted 6 focus groups in the fall of 2023. We had a total of 45 study participants and designed these focus groups with intent. The first set of focus groups involved past and current Penn State research participants. We did 2 of those focus groups. The purpose there is that we felt these folks were already keenly tied into research activities and were interested in what was happening across the research spectrum. So we thought they may be a good source of information when we could learn from them about what they felt regarding lay dissemination. The second group was community stakeholders. This was folks involved in community organizations, both in urban and suburban areas of Pennsylvania. In particular, we worked with the Health Equity Action Team through the Pennsylvania Department of Health and learned from them what their thoughts were regarding lay dissemination. And finally, we involved broad community members in 2 separate focus groups. These were specifically in rural communities of Pennsylvania. These were in-person focus groups, and we did that with intent, meaning sometimes the folks in rural communities have limited access to devices that would allow them to participate in a Zoom. So we felt the best way to get their engagement was to go to them and hear from them in the communities where they felt the most comfortable. In the course of these focus groups, we offered the participants a set of structured interview questions. And among those questions, we were asking them, sorry, I have to put my glasses on, what their thoughts were regarding studies that may or may not, study results that may or may not have been shared with them in the past. Do they know whether research studies had ever taken place in their communities? What research results were shared with them, and if they were shared with them, how did that impact their decision regarding health behaviors and the path towards wellness? And what advice would they give a researcher about how to share research results with their community? What was the best way to reach their communities in a way that was most effective? So what we did in the focus group is we shared with these participants examples of lay dissemination. The first one that we're showing you here is what's called a lay brief. This is kind of a snapshot of a study that gives both written and visual information to the reader about the study itself. It poses the research question, the study findings, some call to action, and general themes that were discovered across the course of the research study. The audience here for this particular type of lay dissemination example is typically for folks who have lower levels of health literacy. That's kind of the importance of lay dissemination in general, is to offer information in a way that's consumable by the greatest audience. So this type, as I said, offers both written and visual kind of cues about what was learned in the study. This is called a lay brief. The second one that we shared, this is a particularly popular one, I think, based on the feedback that we received, is called a data walk. A data walk takes place in the community of study, typically, and also a community that has particular interest in the topic that was studied. So these data walks are typically offered at a time when a community event is already going on. So for example, maybe a back to school night or a health fair or some other occasion that's already gathering the community in one spot. During the course of the data walk, information is presented on, like the slide shows you, these big boards, poster boards, that give graphic images of information from the study. Positioned next to each of these boards is a study team member who can help community members who are walking through the course of these posters to learn from the study member themselves and in partnership with what's presented on the poster. So what I mean by that, although I'm not saying it well, is if there are questions about what's displayed on the poster, the study team member is positioned there to answer those questions. And community members literally walk through these poster displays and learn about the study. This is called a data walk. The third one is called a visual abstract, and it's exactly what the title suggests. So this is a highly visual representation of the study. It uses limited words and a lot of graphics. Again, it's going to give you kind of a real snapshot of the study without getting too bogged down in the terminology that can kind of turn folks away and really lead them sometimes down a confusing path when they're trying to consume information related to healthcare. This is called a visual abstract, and it's a very, very quick snapshot, lots of visuals, limited words to provide participants with a summary of the study results. So over the course of our work, we kind of captured what the research participants, I got this. Oh, I'm sorry, I got distracted for a moment, forgive me. So what we want to do is take some of this information and share with our research teams about what we're learning from this pilot. Overall, the information that we want to share with the research teams is that this is a really, really effective way of not only engaging your community, but establishing a trustworthy kind of relationship with the community in a way that can lead to future participation in research studies. So this speaks really a lot, Carol, to what you were saying before as far as the continuity. So engaging these folks in the dissemination sometimes can really lead to that trusted partnership and ultimately future engagement in research activities, something that Jen also shared earlier in our presentation. I don't know.
Great, thank you so much, Paula. One thing that I did want to share is just some anecdotal findings from our focus group data. We're still undergoing qualitative analyses, so we're pretty knee deep in that process. And a shout out to Candace. I'm not sure if she's still in the room, but she has been helping us from the analysis standpoint and working through all of our qualitative data. It's a pretty robust analysis that we have in place to really generate themes from these focus groups. But I will just share anecdotally what we're finding as we're working on the coding and inter-rater reliability is that it's not a one size fits all. So the majority, though, I will say, a feedback that we've received is that graphics are really helpful and also the human component. So I think what will end up resulting from these findings is a refined methodology to ensure that this lay dissemination is delivered by the research team or somebody that represents research across Penn State, whether it's Cheer working in partnership with the research team or the research team delivering this information and maybe receiving some training on how to speak in lay terms to the broader community. But definitely that interaction, interfacing with the community seems to be very relevant to the groups that we spoke with. And then also this idea of making sure that we are using a lot of visuals and not so text heavy. Those seem to be the two that resonated the most in some of our initial preliminary analyses. A second piece of that, and I just wanted to make a point out because we will be looking at some secondary analyses on some different subgroups. We did have distribution based on geographic location. We have some racial and ethnic diversity in our sample. So specifically when we're thinking of rural versus urban, looking into some exploratory analyses of how that plays a role in the dissemination method that's preferred. So as Paula had mentioned, connectivity issues in rural populations, transportation barriers, making it more difficult to engage in research opportunities. We have to be very thoughtful of what that dissemination looks like versus a different population that can more readily access research opportunities and then also those findings. So our goal in phase 2 is to take all of this work, use it to refine our existing methodologies and come up with a framework for how to approach this more broadly across Penn State. We will be starting with our researchers that funnel through our Clinical and Translational Science Institute. That's the home that we sit in CHEER. And really then piloting some of these refined methodologies on those research study participants to get a sense of what is their preference, which modality seems to be most appropriate. And then, as Paula mentioned, looking at those areas of trust. Did it enhance trust in the research process? And was there intention to act on any of those study results? Any questions on the work that we presented?
Not the work you presented, Jennifer, but the Google Sheet used for the group exercise. I think that's a lot of good information. If I don't know if a student, a nursing student, a PhD, CRNA, any student who are looking into that could turn into into a small perspective paper if it doesn't interfere with your other plans for qualitative studies, because this good data is a nice 500 to 800 word small perspective article.
Absolutely, Rahul. If you want to connect offline, happy to discuss opportunities for that.
Sounds good. I'll leave my email ID.
Thank you. In the interest of time, feel free to pop any questions that come to mind in the chat. We can, of course, always be reached at our email, cheer@pennstatehealth.psu.edu. But in closing, I just wanted to bring your attention, of course, all of our slides will be sent out post-session along with the recording. But I have hyperlinked here for you several wonderful lay dissemination resources. So we're not the only institution, of course, that's looking at this important area of dissemination. And there has already been some really wonderful work done in this space. So please feel free to check out these resources. We were building off of these resources as we develop our version of implementation here across Penn State. So stay tuned for that. I also want to just launch 2 quick polls, if you're still with us. The first is a question: how likely are you to engage in lay dissemination of your study results back to research participants in the broader community? And then which lay disseminate methodologies are you most interested in learning more about? That will just help us as we prioritize what our templates, resources, and future programming could entail to be most helpful to your needs. And we also have our evaluation in the chat. We do ask you to evaluate this session. It gives us wonderful feedback that we really do put to good use. And a question for the chat, something new you learned by attending today's session. It's always nice for us to capture that. I'll end the poll and share some results. I'll take the half of you are very likely to want to engage in dissemination. And for the others that are somewhat or not sure, we'll get you there with more resources and offerings that we can help to support you in that role. Excited to see that you're all interested in learning about all of the potential options. And, there's many more. Those are just a handful of the ways in which we can engage. And I just wanted to draw your attention to 2 upcoming sessions we have. If you haven't heard of another offering we have, it's called Amplifying Line Voices. This is a quarterly series that we do in partnership with our Director of Justice, Equity, Diversity, Inclusion, and Belonging, Dr. Rafi Lucas. And next month, we will be featuring Dr. Lena Huerta Senes. This is kind of a nice change from your typical webinar or Zoom meeting. It appears as though the two of them are sitting in a coffee shop together, and we're kind of just listening in and learning all about the wonderful lion voices that we have that we're trying to really amplify across Penn State among our underrepresented minority faculty and staff. If you're interested in ever being featured for a future ALV series, please do let us know. And then finally, we have an education session also next month toward equity, improving health literacy to meet the needs of neurodivergent research participants. So that one will be a very captivating one as well. Please register, and we'll make sure we have more communications coming out about these. Feel free to contact us. We do consults all the time, always willing to fill a gap in terms of offering an educational training or resource development that you might need. So we're here to support you. Just reach out to us. Always happy to talk. Thank you so much for joining, everyone.